I'm Marie Neer, and I'm a Reiki practitioner.
I'm Diane Anderson, and I'm a Reiki practitioner.
I'm Dr. Kavita Prasad, and I'm the Medical Director at Zambro Valley Health Center in Integrative Medicine.
Good afternoon, everyone. We are delighted to be presenting at the Integrative Medicine for the Underserved conference. We will be introducing our practice of Reiki and sharing the knowledge we have learned by introducing it into our facility. Along with myself, Diane and Marie are our two master level Reiki practitioners who have made this session possible. Our learning objectives today is to share with you how we established Reiki within our behavioral health setting, which may give others an opportunity to learn from the benefits we have seen of patients receiving Reiki. Marie and Diane will go over a description of Reiki, and we have a short video on how a Reiki session is conducted. We will then share with you our outcomes over the last couple of years of providing Reiki in person and also via Zoom during the pandemic. A little bit of background about myself. I trained in England and moved to the NIH and then completed my training at Mayo Clinic, where I was a physician in the integrative medicine department. In 2019, I was lucky to move out into the community to share this knowledge and help bring the integrative medicine practice to Zambro Valley Health Center. Diane Anderson set up the Mayo Clinic Reiki program, and along with Marie Neer, both of who are Reiki master practitioners, we have successfully implemented Reiki into our facility. So Zambro Valley Health Center is a non-for-profit organization located in Minnesota, established in 1966 to serve the behavioral health needs of our community. We have 3 locations in Rochester, Minnesota, and also have facilities for the homeless and underserved population. We provide comprehensive behavioral health support for the patients in Olmsted County and the surrounding regions. You can see from this map of Minnesota, the counties that we serve are highlighted in black. So our vision is to be a national leader of integrated, patient-centered, collaborative health and wellness services. And our mission is to promote a holistic approach to healthcare by focusing on an individual's mind, body, and the community that we serve through providing an integrated approach to patient care. Now, our history is important. We are a CCBHC, which is a Certified Community Behavioral Health Center, one of 8 such facilities in Minnesota. And this has allowed us to really streamline our processes and improve the care which is provided to our patients. Mental health care has been very fragmented in the past, with long wait times for patients to receive appointments and a long waiting lists. And by being a CCBHC, it allows our facility to provide assessments which are developed by a care team, one treatment plan for patients, and getting them into the right facilities in a timely manner. As part of our comprehensive services, we have crisis support, care coordination. We do serve youth and adults in our center with therapy, school-based mental health support, substance use and recovery programs. We have an inpatient detox unit, counseling services, housing support, peer support, as I mentioned, crisis support, and medical and mental health services. We have 2 psychiatrists and the integrative medicine clinic, which I will talk about a little bit further. the patients that we serve, 80% of those that we serve have no medical insurance or are on medical assistance. No patient is turned away from our facility. We do have a grant that serves those that do not have access to health insurance. A very small proportion of our patients do have private health insurance, and most patients that come to our facility have complex health challenges related both to their physical and mental health, and also the social determinants of health, food, housing, and finances. We do provide support for in all of these areas, as well as help people find housing when they are more stable. So as part of the integrative health services that we provide, we do focus on all aspects of healthcare, a really holistic approach to health, using the model that the NIH has. So evidence-based integrative therapies are provided. We provide stress management consults one-on-one with patients through the SMART program, which is short for Stress Management and Resiliency Training. This was developed by Dr. Sood at Mayo Clinic, and we provide this for our staff and for our patients. It brings together the latest research on neurosciences, psychology, philosophy, and spirituality, and helps tailor a program specific to the patient's needs. We also offer one-on-one sessions of biofeedback through the HeartMath program. Reiki we'll talk a little bit more about. We also have health and wellness coaching and an exercise program, knowing that our patients with mental health problems, when they're started on antipsychotics, can develop metabolic syndrome, weight gain, and we have ways to combat that.
So what is Reiki? Reiki is a complementary therapy that uses gentle touch to help the individual deeply relax, enabling the body systems to naturally move into a state of balance and harmony. Reiki enhances the flow of energy through the body, releasing blockages, which decreases tension, pain, and anxiety. Reiki is an ancient natural system of healing that was rediscovered by Dr. Usui over 100 years ago in Japan. Reiki is a word that means universal energy. It's similar to prana or chi. It treats the body, mind, and spirit. The practitioner channels energy to the recipient using light touch. Reiki flows through the body, releasing blockages. It restores balance and harmony to the entire system. And it also allows the body to help heal itself.
The Reiki treatment room contains a massage table with pillows and blankets for the client's comfort. A relaxing atmosphere is created with dim lights and soft music. The client lies on the table fully clothed, minus shoes, glasses, and heavy jewelry. We establish rapport and trust with the client to help them feel comfortable with the treatment by giving an explanation of Reiki, letting them know how we will be placing our hands and what they might experience. The client is invited to relax as much as possible during the session, which helps to release stress and anxiety. If they fall asleep, that is perfectly fine. After helping the client to get comfortable on the table, the practitioner uses their hands to detect energy imbalances or blockages, and then channels universal life energy throughout the body, helping to restore balance and harmony. This short video demonstrates several of the hand positions used during a Reiki session. Keep in mind that the client is normally covered with a blanket, and each of the hand positions is typically held for 2 to 3 minutes, resulting in a session that lasts approximately 35 to 40 minutes. The practice of Reiki has seen considerable growth since it was first introduced in the United States in the 1970s. Reiki is now being offered at hospitals and clinics throughout the country, including those listed here. In 2013, a group of individuals, including several nurse practitioners trained in Reiki, a consulting physician, and myself, established a Reiki volunteer program at the Mayo Clinic. Volunteers were able to provide Reiki treatments for patients in the hospital setting, the outpatient chemotherapy area, and the Cancer Education Center. The need for the program came to light when a growing number of patients were requesting Reiki and other alternative therapies. Our initial findings, based on feedback from the patients, showed that Reiki helps to alleviate pain, anxiety, nausea, the effects of chemotherapy, and negative emotions. Patients also reported an improvement in relaxation, feelings of calm, and well-being. These same findings have been found in other studies and in our program here at Zumbro Valley Health Center.
So Reiki has been established at our facility since 2020, and initially to establish Reiki into our practice, we needed the integrative medicine as a specialty to be introduced to our leadership and to our staff within facility. It was a relatively new concept to many of the staff. So providing education around integrative medicine and what it entails is very important, focusing on the evidence-based approaches that are available to improve well-being and health. Once we had that established, Reiki supplies were minimal. We purchased a bed for Reiki, which is similar to a massage table, a couple of pillows, blanket, sheets that would be required to be changed between each patient session, and nothing more was really required. We established a contract with the Reiki providers, which is renewed annually on a fee-for-service model. And the patients that I have been referring to Reiki have been those whose mental health is relatively stable on medication. There are really no exclusions for a patient to receive Reiki as long as they can lie flat on a bed for the period of the Reiki session, which is anywhere from half an hour to 40 minutes. There have been no side effects with Reiki treatments and no interactions with medications, not had any patients who attend Reiki sessions come back to me and say that they've had worsening of their mental health symptoms. So it's really minimal in the amount of supplies you would require to establish Reiki at a facility. So now looking at the data from the last year, we looked at, before a patient has a Reiki session, we ask them to fill out a very brief questionnaire, which has these symptoms, the variables listed on the left-hand side. And next to each variable, there's a score from 1 to 10, and patients fill out the level of pain on a scale of 1 to 10, their level of fatigue, level of anxiety, level of stress, how sad they're feeling, how agitated they are, their happiness levels, are they feeling energized, relaxed, calm, and each of these has a score from 1 to 10. So pre-treatment, you can see in the first column, pre-treatment scores and post-treatment scores. And then we looked at the change in the scores before and after a Reiki session on the same day. And you can see that most of these were statistically significant changes pre and post Reiki sessions. And I'll show these a little more clearly on the next slide. We also looked, the pandemic hit us in the middle of starting these Reiki sessions. So we switched Reiki over to Zoom during the pandemic as patients were noticing benefit with Reiki. And many of our patients, we are the only source of support for their emotional and mental health. So it was important for us not to stop services, and patients were able to continue Reiki via Zoom during the pandemic. During that time, inpatient sessions were also continuing, and 79% of treatments were conducted in person, 21% were conducted via Zoom. The only statistically significant difference was in anxiety changes in scores between Zoom and in-person sessions, but all patients noticed a benefit in these variables. This was surprising for our psychiatrists. You know, the amount of benefit that they saw with patients receiving Reiki was more than what they see for when patients are started on medication to improve their mental health. And this graph just shows us the average effect of changes pre and post Reiki on positive emotions. So in blue, we have the score that a patient reports prior to starting a Reiki session, and green is their score after they have completed a Reiki session. So you can see that their calmness improved, they felt more energized, happier, and more relaxed after the 1 hour Reiki session. We also looked at negative emotions and pain levels. So on this graph, prior to the Reiki sessions, the score is in blue, and after the Reiki session, the score is in green. You can see that agitation reduced after a Reiki session, as did anxiety, fatigue, sadness, stress, and pain levels also reduced after having a Reiki session. This shows the average change in their score from baseline to after treatment between the different variables that we talked about. And I wanted to share with you the largest trial on Reiki that was published from Harvard University along with the Center for Reiki Research. This study was published in 2019. And the main purpose of this study was to measure the effect of a single session of Reiki on physical and psychological health. It was a single arm effectiveness trial with measures pre and post Reiki sessions, similar to what we had performed. The practitioners were master level Reiki providers from across the country. 99 Reiki practitioners were enrolled in this study. And each session of Reiki was between 45 and 90 minutes. They used a validated 20-item positive and negative affect schedule to measure affect, and also a single item self-reported measure was used to measure a wide range of physical and psychological variables immediately before and after the Reiki session. During this time, a total of 1,411 Reiki sessions were conducted and included in the analysis. And similar to what we saw, improvement in positive effect was seen, a reduction in negative effect, and reductions in pain, drowsiness, tiredness, nausea, appetite, shortness of breath, anxiety, depression, and overall well-being, with all p-values being statistically significant, showing that the single session of Reiki improves multiple variables related to physical and psychological health. We have also, this showed that the Reiki really can successfully be introduced into any health clinic, and it's very low cost and we've seen great success with it. Zumbro Valley's mission is to provide hope, one life at a time. We feel that our work is meaningful and we are able to help others through their periods of distress. it's in serving others that we all improve and rise. Now, I'm very happy to have presented today. I thank the IM4US conference folks who have been wonderful in giving us this opportunity to share our work. We also wanted to thank our amazing IT team, Andrew Curran and Tracy Schmidt, without who this work really would not be possible. If anyone does want any further advice or input on how to set up Reiki, you can send an email to myself and I'd be happy to share any further information that you require. And thank you again.